Hello viewers, welcome back to Nkechi's Health Tips. My name is Nkechi and I'm glad to step out again for another discussion today. Risk factors of stroke is my topic for today, and as usual, let's get straight into it. So what is a stroke? A stroke usually occurs when blood flow to the part of a brain is blocked. This causes the brain cells to be deprived of oxygen and they begin to die. People start to experience paralysis as a result of brain cell death, and some will have their ability to speak or walk hindered. Stroke is a leading cause of disability around the world. Understanding the risk factors of a stroke can help in prevention of stroke, and this is very important because the management and recovery from stroke is a lengthy journey and is usually unpredictable. Number 1 point, high blood pressure. A normal blood pressure is 120/80 millimeters of mercury or lower. When blood flowing through the blood vessels is at a pressure higher than this normal range, we have high blood pressure or hypertension. At times, high blood pressure can go on undetected in some people for long because it can have no clear symptoms. As a result, it can lead to stroke because the blood vessels are damaged over time and blood clots are formed in the blood vessels in the brain. So if you're listening to me right now and you have high blood pressure, please note that the management must include regular physical examination and blood pressure checks, making lifestyle changes that can lower your blood pressure, eating low sodium or low salt, well-balanced meals, keeping your weight in check, regular physical activities or exercise, limiting alcohol intake. Applying all these tips will help in preventing stroke. Second point, high cholesterol. Too much cholesterol in the bloodstream can cause a buildup of plaque in blood vessels, which can lead to blood clots. This can reduce blood flow to the brain, causing a stroke. To maintain a healthy cholesterol levels, here's my tip for you. Eat a healthy, heart-friendly diet of fruits and vegetables regularly. Also, foods that are low in sodium and fats. Exercise regularly as well. 3 points, smoking. Smoking is another risk factor of a stroke. Cigarette smoke contains toxic chemicals such as carbon monoxide, which can damage the cardiovascular system and increase the blood pressure. Smoking also causes buildup of plaque in the arteries, and accumulation of plaque can cause blood clots, which reduces blood flow to the brain. Smoking increases the chances of forming clot. So if you're smoking, please take note of these points. Fourth point, diabetes. People with type 1 and type 2 diabetes are also at risk of a stroke. There is no cure for diabetes, but with medication and proper diet, you can maintain a healthy blood sugar level. This reduces the complications such as heart attack, stroke, organ damage, as well as nerve damage. 5. Some underlying diseases. Having an underlying disease is another risk factor of a stroke. Diseases like peripheral artery disease. This is a narrowing of blood vessels as a result of buildup of plaque in the artery walls. Arterial fibrillation, which is an irregular heartbeat that causes poor blood flow and blood clots that can travel to the brain. Heart diseases like coronary artery disease, heart valve disease, and congenital heart defects can cause blood clots. A personal history of transient ischemic attack or mini stroke. In conclusion, having this basic understanding of factors or risk factors of a stroke is key to preventing a stroke. If you have more or one of these risk factors, you should ensure strict compliance to your doctor's treatment, and of course, there are treatment regimens for stroke. But most importantly, prevention is more important than a cure, So work at lowering your chances of having a stroke. See you next week for yet another follow-up on this discussion. Have a lovely day.